Good morning, good evening, good afternoon, whatever time of day it is for you. I wanted to spend a few minutes explaining a saliva hormone test and why we really never look at blood levels of hormones and why we use a particular company that actually is collection of your saliva 4 different times throughout the day to really paint a picture of your free hormones plus your adrenal function. There's 3 levels of adrenal fatigue, and each of those requires different root cause approaches. So traditional blood work for hormones is really designed for a prescription model. If you have low testosterone, they can give you testosterone. If you have low estrogen, they can give you that synthetic or bioidentical estrogen. Whenever you give the body something that it should be producing on its own, you actually shut down those systems and make that area weaker over time by providing that short term relief for something you're lacking. Instead, we want to fix the root cause of what's happening. We can actually get the body to produce more hormones. Even if you're premenopause, postmenopause, the body's always producing hormones. They just change their ratios as we age. So simply giving them to the body really has a lot of side effects and it makes the systems a lot weaker over time. It's kind of like, if somebody takes melatonin, people don't realize the brain produces that. And so if I take melatonin for long periods of time, you shut down your own melatonin production. The same with stomach acid. Some of the supplements out there are literally stomach acid in a pill. So if you take that, it may calm your digestion. However, it's going to shut down your body's production of acid even more in the stomach. It's no different with hormones. So a lot of men, after they get on TRT, for example, their testicles actually shrink up. So when the brain says we have enough of something by giving it to the body externally, the organs that produce those things literally wither away because they're not being used. So use it or lose it. And so free hormone levels is really what we want to look at. That's what determines how you feel and how most things are functioning in your body, not the total number being high or low. So a saliva test is required to do that. So this is the kit that we send you home with. So this is an at-home test. This is 4 different tubes that you fill up with your saliva before breakfast, before lunch, before dinner, and before bed. This paints a pattern of cortisol levels plus all the major hormones in the free form of those hormones. So now, with that information, we can figure out your hormone blueprint and actually start rebuilding or strengthening those organs, such as the adrenal glands, or getting the body to produce more testosterone or progesterone or whatever it is. But we have to get the right information first. Without the right blueprint, and this is what a lot of people do, they just start throwing, chemicals at you, essentially prescriptions, and you feel good for a while and then you don't. And then we have to do more labs that tell us where that total number is and then titrate down or up. We want to fix the body's ability to produce and balance these things. So, benefit number one, hormones are literally the feel good molecules of your body. A lot of people don't feel good. They have low energy, they have foggy brain, they have low drive, they have terrible sleep. So when we balance hormones, we literally have transformed people's lives by doing this because it literally helps us feel better. And if they're out of balance, we don't feel good at all and we don't want to do things. We don't want to perform at our job or, hang out with our kids or wife because we're just exhausted. So these are the feel good molecules. We want to balance them. Women often have these symptoms when they're out of balance: hot flashes, night sweats, breast tenderness, irritability, forgetfulness, irregular menstrual cycles. It's just a very common problem. That's why we do this test frequently on people. Men experiencing decreased libido, erectile dysfunction, loss of stamina, decrease in mental sharpness, reduced muscle mass over time, increased moodiness, metabolic syndrome, prostate enlargement. And then both men and women can experience weight gain with imbalanced hormones, high blood sugar, elevated lipids, cholesterol, inflammation, insomnia, fatigue, fibromyalgia, decreased stamina, anxiety, depression, chronic disease. So you can see how powerful hormones are. They literally are the feel good molecules. So when they're out of balance, we're going to have all kinds of different symptoms. There's not a symptom that will tell me which hormone's high or low or what's out of balance, your adrenal fatigue. We have to find that blueprint. That's where testing comes in. Often people they can't even describe how they feel. They just don't feel good and their brain doesn't work well and they're tired and their memories start slipping and things like that. So these are tests that I've used for decades with people. My whole team lives and breathes what we do in the office. So we're very specific with what labs we use. This is literally our own healthcare model we're sharing with you. You can talk to any of the team members. We've all done this test and we've all been working on our hormones and balancing them over time in different shifts of life. different stress levels. It's a constant process that you want to keep working on because, again, hormones are the feel good molecules. And tests like this is why I have not been to a medical doctor in 25 years. I've not had a prescription in over 25 years. So, again, this is what we live and breathe. We're always finding the best labs and the most accurate tests and the best way to do things. There's really three things that happen in the body: either toxicity, which is too much of something, deficiency, which is not enough of something, or some sort of an imbalance. And so the hormone profile, when we get your blueprint of this, it's kind of more in the imbalance category. However, there's a lot of toxicity that can lead to hormone imbalances, but also a lot of deficiencies that can lead to these hormone imbalances as well. So you can see it's not as simple as your testosterone's low, here's your testosterone pill or injection, right? It's much more complex than that. And so our medical system has really simplified things too much because, what they can offer us is a prescription. So we just care what's high or low, and then we want to force them the other direction, but that never addresses the root cause of the problem. And so menopause and andropause, these are big issues. Obviously, there's a huge symptomatic shift, between 30 and 50 years old now. It shouldn't be that way. Yes, every decade we age, our hormones will fluctuate and change. But because of our westernized habits, poor diet, lack of exercise, smoking, alcohol, other medical conditions throw off our hormones, and hormones also throw off these medical conditions. And psychological, this is really the big one, because if our brain isn't high functioning, right, we just don't live our life very well, right? We're not as good at our jobs or our relationships. So these are very big, common problems. Every human should be doing this test at least once a year. Sometimes we might do that test again in 4 to 6 months, sometimes a year later, but we want to keep looking at this indicator because we want to constantly try to optimize these hormones over our lifetime because, again, they're the feel good molecules. So why are they a mess in almost all of us? Because of toxins. Toxins are the main thing, and stress. So BPA is a hormone disruptor. There's all these PFAS chemicals in our environment, phytoestrogens in our water supply, pesticides on everything, phthalates, flame retardants, and dioxins. These are just unavoidable now. So it's not really a matter of when or if you'll have a hormone problem. We all have hormone imbalances. I've never tested somebody and they were just perfect. And then a year later, they're perfect again, right? These stresses are inevitable. So we want to constantly be looking at these so we can optimize them so that we can feel good. There's a time and place for this, of course, but adverse drug reactions are the third leading cause of death. So I'm always looking for ways, how do I avoid this or prevent the need for this sooner in my life than earlier? And this is really the main reason. I want to fix the root cause in my body, not just rely on all these prescriptions to force something high or low, which come with side effects. And this is kind of crazy. Only about 1% of serious drug reactions are actually reported. So if adverse drug reactions are the third leading cause of death, but statistically only 1% of serious drug reactions were reported or reported properly, it's got to be much higher than that, right? So this is really the purpose of why we do what we do. So this is a birth control and hormone replacement therapy study that I show people. You don't hear much about this anymore, but basically years ago, there was a study that came out that a lot of people saw, and it scared a lot of women to stop taking their birth control or hormone replacement therapy. This is basically oral contraceptives taken for 4 years of birth control had a 52% risk of developing breast cancer, for example. So that raises our risk of certain things. In 2005, the World Health Organization wanted to classify these hormone replacement therapy and birth control as a carcinogen, actually. So this is the study I mentioned. USA Today, December 14th, 2006. There was a lot of people that saw this study that basically showed that hormone replacement therapy and birth control were not great for us. 200,000 cases of breast cancer are diagnosed each year. So this USA Today study from 2006, about 30% of women older than 50 took hormone therapy until the 2002 report that came out, at which point roughly half of them stopped. So there's only about 15% of women, not 30, after they saw these side effects in study that stopped. There was a smaller amount of women taking these drugs. And ironically, since 200,000 cases of breast cancer are diagnosed each year, there was a 7% drop when half of these women stopped taking their birth control or hormone replacement therapy. So there's literally 14,000 fewer women diagnosed in 2003 because that 2002 report made about half of those women stop taking it because they got scared of it. But that's crazy to me. So 50% of the women stopped taking either birth control or hormone replacement therapy. The following year, there was 14,000 fewer women diagnosed with breast cancer. So just to give you an idea and some perspective why we do what we do. And I don't like hormones with women too, especially testosterone. This is when you're going to have some of the things that we don't want to happen in the body. So if you take TRT, for example, as a woman, whether it's a cream, injection, you will likely get deepening of the voice. You will likely get some facial hair growth, which we don't want, obviously, enlargement of the clitoris, menstrual irregularities, and blood clots. So these are all things that can happen with hormone replacement therapy. And those are obviously unwanted side effects. And also, again, the organs shut down and stop producing the hormones, not just testosterone, but all hormones. If I give you something your body produces, it will shut down its production and that system will get weaker. So benefit two, again, the free hormones are what determine how we feel. So we have a total number, and then of this big total number or small total number, there's actually a small percentage of that total. Let's say this is 100. There's only about 2 to 3% of that 100 that is actually free. And the free is what gives a male that drive, or a woman, good brain health, right? So it's the free hormones we want to look at because that's what we want to keep in optimal ranges over time, not just a big total number, because you could have a very big total amount of testosterone or estrogen, but it's a very small amount of free. So you're still not going to feel very good. So we want to measure the free. That's what saliva testing does, because that's what is going to determine how you feel actually. This is a chart showing you, this is the total number. Think of this whole circle as your total testosterone or your total estrogen or total progesterone. A small portion of that is actually that 2 to 3% up here is free. And again, this free version is what determines how you feel, how much energy you have, how well you sleep. So it's not about this big total number. It's about how much is free, how much is bioavailable, so that I actually can use it for all the things that hormones are used for. The ranges for a total number of estradiol is anywhere from 20 to 350. You can see this huge range of normal. That's not the optimal range though, right? So it's such a big range that you could be anywhere in here and still not feel good because it's not in the optimal ranges. Progesterone can range from 300 to 2,500, right? What a huge normal range to call me normal. Now, people don't realize normal ranges come from a generally sick society. Americans have some of the poorest health in the world. I don't want to compare myself to this normal, really broad average range from a normal, not very healthy individual. It just doesn't make sense to me. I want optimal ranges for my health and my family and my patients. Total testosterone normal ranges are 291 to 1100, right? It's so big. It's kind of silly to even look at these. Normal range is anywhere from 26 to 240. So you can see these normal ranges are just too broad. They're not optimal. It's not a good indicator, especially using a total number of your testosterone versus the free. So the normal ranges on your lab work are based on averages of sick people, people on medications, people with chronic inflammation, chronic disease, chronic brain fog. So when your results come back normal, it just means that you're statistically average in a very sick population, as I mentioned. So this is a big industry. So I realize we're all conditioned to think we need to go get on these hormones and do a blood hormone test, which shows me my total number. And then it's simply designed for a prescription model, right? But remember, pharmaceuticals or medications are actually the third leading cause of death. I realize this may be going against some of what you've been taught or told and what everybody around you is thinking, but it's really just, it's a big business. Let's say that. So free testosterone. This chart here, if you look at these red bars, those are men, and the pink bars are women. And this is just looking at one hormone, testosterone. So men and women, we really don't have that big of a difference of how much free testosterone we need in our body to be healthy, right? So this is an important thing to optimize in our body, because really testosterone in men and women, not excess amounts. I don't want to give you TRT, but in optimal ranges of that free level, not total, helps us feel good. It literally gives us our bone density, our muscle mass, our brain health, our drive, our stamina, good sleep. So again, the free numbers, if you look at this, the men and women are not really far off. So it's an important hormone in both of us. So saliva hormone testing is often considered superior, which I've seen this time in and time out, all for years, decades. That measures only the unbound or biologically active or bioavailable hormone that can freely enter the tissues. Again, it's the ones that make us feel good. It's really the number that we want to monitor to make sure that I do feel good by balanced hormones. So it's the best way to test. This is the test that we use. This is an example of your results after we do this saliva test. You can see it's going to measure your estradiol, your progesterone to estrogen ratio as well as your testosterone and DHEA. So all the main hormones in the free levels, not the total number. Okay. So this is a sample report. You can see this is what you'll get at the end of your test, usually within 2 to 3 weeks after we run this test. And then really important is measuring 4 different cortisol levels. One is before breakfast, and then you do another test before lunch, before dinner, and before bed. What this now shows me is how weak or strong your adrenal glands are. Our adrenal gland is our stress gland, but it also produces many hormones that we need to feel good. So this person here is showing a phase 2 adrenal fatigue. There's 3 levels: phase 1, phase 2, phase 3 is the worst. Phase 3 is like complete exhaustion of your adrenal glands. You've had stress for years and decades, chemical, mental, and physical stress, by the way, not just mental stress, but overall physiological stress that just wears out our adrenal glands. So we need to see what phase you are, because each phase requires a different protocol to get better and help the adrenal glands get stronger over time. So this is really critical. If you're not measuring adrenal function with your master hormones, with the free molecules, we're not going to get very far. Again, it's simply going to allow somebody to give you a prescription, which does not affect the cause or root cause. So the 4 stages, basically wired for sound, soon to burn out. This is kind of the initial phases of stress. Phase 2 is wired and tired. So a lot of people have allergies, infections, things like this. Your adrenal glands are just wearing out. And then we have wired and tired. Again, and this is a more severe example, phase 2, which is kind of inflamed and in a lot of pain for years now. And then just plain tired. When somebody's tired all the time, no matter how much sleep they get, this is typically a stage 2 or 3 adrenal fatigue. So each of these we have to fix differently. It's different protocols and biohacks or treatments, so to speak, to help based on what phase you are. But if we don't do a test, we're just guessing, right? We want to know exactly what your blueprint is versus mine and work on that over time so that we can actually strengthen and get to that root cause. So addressing root cause allows fixing of problems without the side effects. When we work on these root cause issues, it's safe. There's 0 side effects. We're not using chemicals or synthetics to actually strengthen those organs, but we're also using evidence and retesting to show an actual improvement versus just feeling better temporarily, which is a lot of times what hormone replacement therapy does. Some side effects of hormone replacement therapy: tender breasts, hair loss, weight gain, headaches, double vision, chest pains, jaundice, depression. All drugs come with side effects, is the point. So again, this is how most people feel. They just don't feel good. Maybe more prone to depression, anxiety, memory issues, sleep issues, you name it. So the feel-good molecules can affect everything, every aspect of our life. Here's the test kit that we send you home with. So we walk you through. Men can do this virtually any day of the week. Women, we have to time this. If you're a cycling female, we have to time this within a 3-day window of each month. So we'll walk you through that so that you do the test properly. This saliva test is super important. We literally run this at least once or twice a year on ourselves so we can keep optimizing our hormones, our feel-good molecules. We can walk you through this, let us know what questions you have, and we can get started finding out your unique blueprint for hormones and start working on that root cause. Thanks.